Hello, thank you for joining me. My name is Peter Lachapsky, and today I'm going to show you how to chart in Oscar 19. I'll give you a little bit of an overview. Here we go. We start, as always, in the encounter screen. You might have a patient already booked for you, in which case you can just click on the encounter, E, and go there to that chart. Or you can click on and add in a patient. Let's say they just dropped in. You can click on the calendar template and go to the booking form. Let's say we're trying to double book against this one. We simply put in the patient's name. So let's use not a patient. And it's going to be an in-person visit, and it's going to be for travel advice. Okay, and you simply add the appointment. Okay, so let's go back to the screen here. I didn't add that appointment. I'm going to go click to the e-chart. I have that loaded here. And so we're going to do a template, and we're going to do a travel template, which we've created for this purpose. So let's say travel appointment, and that fills a bunch of stuff out. Let's read the template. The patient is presented for travel advice for an upcoming trip. The patient's identity, and then there's this funny little thing here with the angle bracket. The angle bracket for smart templates allows you to either click or tab to them. Okay, so let's try tabbing. We'll tab, and that selects that one, and you can just enter that one. And by tabbing and entering, you will pick that option. The other option, of course, would be just to click it. So click it, you would have that done. So let's say we tabbed, we entered, and we picked one of two various options for the various sites that we can use for travel advice. We picked the Massachusetts General Decision tool, and I've helpfully added in the URL so we can proceed there to that site. This is already, let's just refresh it. Cancel, let's just Control V and go. There we go. There we go. Okay, so the first time you open this, so you're going to have to put in who you are, primary care physician or a specialist or nurse or pharmacist or someone else, where you practice, your zip code, use 99999 for Canadians, and your country. And I would suggest you click this checkbox so that next time you use the Massachusetts General tool, you won't be asked that again. You won't have to fill it again. You have to transfer over the information of how old the patient is, 54, for example. He's male. We're going to, let's say, the Dominican Republic. It's a common destination this time of year. Not Democratic Republic of Congo, but Dominican, and not Dominica, but the Dominican Republic. There's a number of countries in the itinerary. Enter them all. You add any special circumstances, returning home to visit family or friends, which certainly does increase the risks of waterborne disease dramatically, or other sort of issues that might come into play. Then also personal issues in terms of egg allergies, immune system, and so on. Let's say that this person has chronic liver disease. Let's view the recommendations based on these criteria. So here we go. What I do with people is I copy the traveler's 54 male traveling to the Dominican Republic and his reported chronic liver disease. These are the inputs that the tool used, and for reproducibility and for following the patient's chart, I just click that and copy that there. So the following patient's history and pre-existing risk factors were entered to the Massachusetts General tool. The patient is a 54-year-old male traveling to the Dominican Republic, and he's reported chronic liver disease. And so we follow, and we go review this with the patient in terms of vaccinations, routine vaccinations, hepatitis A, typhoid, influenza, rabies vaccine, avoiding insect bites, which is important for dengue, chikungunya, and Zika, although there is no Zika outbreaks currently in that part of the country, in that part of the world. However, you can check the map if you so choose. So here we go. If you click that, for example, for the map, and you'll see that there's actually no place that is currently in a Zika outbreak. But nonetheless, it's still good for all the other diseases, particularly dengue, to avoid being bitten by mosquitoes in that area. Malaria is present in some areas, depending on the itinerary, okay? And so you have to go to the Dominican Republic. Click here, and so does this person need, for example, prophylaxis with regards to malaria or not, depends on which resort he's going to. So let's go over here and go into the Dominican Republic, and you can see that for malaria, near the border of Haiti, the provinces include resort areas of La Gracia. Okay, so of course, you know that Punta Cana is in that province, and so that he's going to be going, you'll have to look that up. Google can help you, and you'll determine, yes, they're at risk for that. Okay, so going back to the travel advice, so he needs something. Chloroquine should only be given to travel to the Dominican Republic. Okay, so if you had a multiple state, multiple place itinerary, and if you're going to a state that has malaria that is chloroquine resistant, you would pick another agent. But in this case, we'll pick chloroquine. And we've got issues with regards to traveler's diarrhea. We have a standing handout, so you can use the English one, for example, or even the French one. So the French one would look like this. This is thing, and this is the English one. And you'll talk about medications, taking them, the importance to continue them on your return, protecting yourself from bug bites. Be careful what you eat. Ciprofloxacin, I would point out, this is a 2014 form. Ciprofloxacin is no longer recommended for traveler's diarrhea treatment, and azithromycin is now an option. Is perhaps a preferred option if we're going to give it, although there's some controversy for that. And of course, road and motor vehicle safety, because that's the most common cause of death or injury in a traveler. And also important piece of advice that you need to seek medical attention if you develop a fever on your return. It can take several months for malaria to show up. And of course, other diseases, myriad other diseases as well. Getting back to the not a patient. Okay, so let's go ahead. We're going to insert his vitals. We want the person's weight. We did a weight recently. That's probably good enough. 92 kilos. So adult 92 kilos. The standard dose of should apply. But we could enter it here if we so wish, and chart that. In this particular case, we go through the various options here. So malaria chemoprophylaxis, it's actually indicated. Hydroxychloroquine sulfate will do. We just pick that. I can never spell that properly. In fact, I've misspelled it here, but so be it. Let's go over to prescriptions. We need to write a prescription for it. And we're going to write hydroxychloroquine sulfate. So I've got it actually demoed here, but if you don't know how to spell it, you can just copy paste into that area. But if you notice, I've actually got that template incorrectly spelled. We'll have to fix that. Hepatitis A, in this case, they recommend it, and we're going to recommend it to our patient. Hepatitis B is not indicated in this patient. Rabies is not indicated in this patient. He's going to be on a resort. He doesn't feel there's going to be any risks. Typhoid, they recommend. Japanese encephalitis is not an issue there. And yellow fever, he's not traveling from a yellow fever country. And Dominican is not a yellow fever country, so it's not indicated, and it's not on the list of recommendations. This management sort of is covered through the handout that you can get that we demonstrated. which would include general travel advice to minimize risk of violence, motor vehicle accidents, vector-borne disease, and waterborne disease. Over-the-counter travel kit with dressing, sunscreen, DEET, insect repellent, as well as acetaminophen and Imodium or bismuth recommended. Patient advised to keep all original packaging for medications for custom control. The need for mentioned prior traveler if the patient becomes ill on return was emphasized. Routine immunizations reviewed and updated as desired, and through a shared decision making, the following shots and chemoprophylaxis were done. So we go back to the prescription. We're going to do Havrix and hydroxychloroquine sulfate. So because it's in the template, I could just cut and paste. So let's go ahead and do that just to show. I put hydroxychloroquines, but obviously that's a mistake. So let's just do the hydroxychloroquine side. We'll copy that, Control-C and Control-V. We'll get you that. We need a few things. There we go. That's the one we want. And then we use the standard device as mentioned here. So we'll just renew those. I guess you must have been there to a country like that before. What we'll do is we'll save it next. Okay. Cancel. We need to fill that out. So we need about 12 tablets for 2 tablets weekly starting 1 week prior, 1 week there, and for 4 weeks return. That's 12 tablets for most adults. And Havrix is 1 ml at 0 and 6, something between 6 and 12 months for ongoing immunity. Interesting enough, one injection will give 90 to 97% protection against hepatitis A. It just won't last. We'll save it next. And we will, my signature is automatically stamped in there, and we will paste into the EMR. Usually would fax it, but in this case, we're just going to paste it. Now we get back into the encounter, and you can see that through a shared decision-making process, the following shots of chemoprophylaxis were prescribed, the chemoprophylaxis being the hydroxychloroquine sulfate and the Havrix. But we had to fix this template. So hydroxychloroquine sulfate, how are we going to do that? Well, we go through administration, through eChart, manage eChart templates, we select travel, we edit it, and then here you can see that hydroxychloroquine is misspelt. It should be like hydroxychloroquine, and we will save that. Okay, and that is that in a nutshell. I hope that's been helpful. Bye now.